When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by LinkedIn. Psst, healthcare pros, word's out, and it's too good to keep quiet. Look, LinkedIn is revolutionizing job hunting, making it possible to search by specialty, shift preference, and salary. Endless scrolling is out. Whether it's a mental health therapist or dental hygienist, finding the perfect role is faster and easier than ever. Head to linkedin.com/healthcare and start your search today.
Dr. Raj.
Dr. Raj Dasgupta.
The most interesting pulmonologist in the world.
Welcome to the Dr. Raj Podcast, a show all about empowering knowledge, addressing difficult topics, raising awareness, and being positive. Dr. Raj is a quadruple board-certified physician, associate professor of clinical medicine, and the associate program director of internal medicine residency. He was a co-host on the TNT series Chasing the Cure with Ann Curry, as well as a regular on the TV show The Doctors. And now, here's our show.
Hi, and welcome to the Dr. Raj Podcast. And what is this a podcast of? A podcast of happiness and wellness, of great stories, amazing people. And today, I gotta tell you, everyone, I am super excited to announce a new series on my podcast platform. That is right. And it's gonna be called Everyday Rheum. And I think it's going to be starting on November 5th. It's going to be once a month. So I looked at my calendar and I was like, OMG, that is like less than 30 days away. I think it would have been a great idea to actually do a podcast to introduce my mystery guest host who's going to be doing this. So for my listeners, you know how we do things here at the Dr. Raj Podcast. I always do a bio, then I introduce my guest. But this introduction is going to be extra special to me. So my new co-host did her training for internal medicine residency at St. Luke's and Roosevelt Hospital. At the time, I was there. It was under Columbia University, which was pretty cool. She went on to do her fellowship at the University of Pennsylvania, Penn for rheumatology. And it's true, she got Fellow of the Year. I'm so proud of her. She went on with her academic track and worked at the University of Southern California, got an assistant professor title, then worked for these big health organizations like Healthcare Partners and PIH. For those who don't know, that's Presbyterian Intercommunity Hospital. Currently, where we're recording this podcast, she's at Huntington Health, which is an affiliate of Cedars-Sinai. And at the same time, she's working in an underserved clinic. I just love that part. And somehow, between all these things, she started her own practice, which is a model called direct care rheumatology. I'm going to let her talk about that. What I'm most proud of and honored to say is that she is my wife. She is an amazing mom. We have 3 kids and a dog named Clifford. Our middle child, Aiden, has autism. And despite all this, she is the model of hard work, honesty, and empathy. And here to talk about her new podcast and what is this direct care rheumatology is Dr. Michelle Koolaee.
Oh my gosh, wow. That was the nicest introduction. Thank you, Dr. Raj.
Oh my God, you called me Dr. Raj. That's so weird. This morning it was more like Honey Bear, but now it's Dr. Raj. All right, I have to get used to that, man. So I do have my list of questions, you know what I mean? And I actually just want to go out of order and start talking about podcasting. But I was just thinking that, certain doctors, people know what they do just based on the name, like cardiology. I think most people think heart. But rheumatology, that name always was weird to me, especially when I was in med school. So Can you explain what a rheumatologist is and all that kind of stuff?
Definitely. I would love to explain. So there's a lot of different conditions that a rheumatologist takes care of. Number one, we take care of all different types of arthritis, whether it's osteoarthritis or rheumatoid arthritis. We take care of different conditions that cause chronic inflammation. And these conditions are oftentimes autoimmune, and sometimes they're vasculitis or lupus. And we also take care of bone health, so osteoporosis, osteopenia. And so it's kind of a mixed bag. We take care of different labs. If people will see us if their labs are checked and they're abnormal, different autoantibodies. So there's a lot of different conditions that a rheumatologist will take care of.
So you said bone health, osteoporosis. My mom has that. So you're going to take care of my mom. She's your mother-in-law, and she's going to listen to this podcast.
I would be happy to take care of my mother-in-law.
You know she's going to be non-compliant.
Yes.
Did she get like a family discount, or should we not give her discounts?
That's funny.
Well, she is good. I love what she does around the house, dude. She's amazing.
No, she's amazing. We love her.
So, one thing that you told me during your training was that you felt that being a rheumatologist, no one wants to be on lifelong meds. And I actually kept that saying when I see my patients because it means a lot and it prevents me from being a drug pusher. I just feel like knowing a bunch of different rheumatologists, if anyone pushes drugs, it's got to be you guys, right? Everyone's got prednisone in their pocket. Everyone thinks they're on some chemotherapy like methotrexate. I mean, besides all these meds that you may or may not give, are there effective non-drug therapies for rheum patients?
Oh, yeah. And when we talk about one of the main reasons that I explored and transitioned actually to direct care was so that we can talk about and have time more than the 15-minute appointments to talk about what is part of treatment aside from the drugs that we give. And this has to do with lifestyle, right? So I think number one is getting good quality sleep. Sleeping deeply is the best medicine. And a lot of people they have issues with sleep, and that is so closely connected with chronic pain symptoms, as is stress. So that's been proven. And
so is it true when people say stress flared up my rheumatoid arthritis? Is that true?
100%. I hear that all the time, every day. And so there needs to be a safe space where people are able to talk about sleep, are able to talk about stress, are able to talk about diet, and the diet plays a big part in managing inflammation too. And also, most importantly, is having a healthy mindset.
Yeah.
And and activity, having some routine of activity, all these things we are all aware of need to be part of our general health and wellness. But that's hard. It's hard. It's like a moving target. And everybody, whether you have an autoimmune disease or not, you're constantly working on bettering health and optimizing health. But to answer your question, that definitely people that have chronic inflammatory diseases is that the meds are an important part of it, but so are these other elements that we just went through that have to do with general health and well-being.
And you have a bunch of friends now. Ever since you started this new direct primary care, I can't even direct room care. I can't keep track. Who are some of the people who you teamed up with, and what do they focus on? So are they nutrition? Are they physical therapy? What are you teaming up with?
So it's this beautiful ecosystem that is like a network for people where I have a nutritionist, trusted nutrition colleague, that people that I know would benefit from bettering their nutrition to manage their symptoms. I send them directly to him. I trust him. I know how his practice works. And so I've been to his office. This is the same thing for, I have a referral that's amazing, and he is a mobility expert.
Nice.
And so people that need support with balance, with mobility, with having an exercise routine that's really meets them where they're at. He's great for that. And I've even been lucky to partner with a functional medicine doctor. And I actually first learned within the last year more about what a functional medicine doctor does and how their approach and looking for root causes and of symptoms really in the right person can match and partner with so nicely with some of the care that I provide. So I think it's just having that space to be able to partner with, of course, physicians and having physician colleagues, I think is really important. But it's other people in your community and in your treatment circle and support circle that can be really helpful when it comes to chronic pain and chronic rheumatic diseases.
No, I've been seeing you networking. I'm so impressed. And we gotta buy so many holiday cards now. Oh my God. I'm just thinking we're gonna go to the Bath and Beyond, dude. There's a Bath and Body. Where do we always go?
Okay, so my running friends they're really good. They know all the little cute little stores in downtown for fun little gifts and stuff. So yeah, there's a lot of people that I'm tremendously grateful to have as just collaborative partners together.
And so are you going to make space for me? Because you started off this answer about sleep. And I'm like, yo, if you see one of my board certifications, it's like Dr. Raj and sleep, man. So we should team up down the line.
Okay. I would
you know what I mean?
Yeah.
All right. I just want to make sure you plug myself in there.
Definitely,
you know?
Definitely.
All right. So one thing I think someone asked me on a different podcast was when I diagnose people with things like pulmonary fibrosis, that sounds horrible, COPD, or even narcolepsy, how do they react? You know what I mean? And what do I tell them? And what's my way to say things? So my question to you is a disease like a fibromyalgia, a disease like a rheumatoid arthritis. What is your what advice do you give to these newly diagnosed patients when you just lay this down there like, hey, this is your diagnosis?
Yeah, really important question. I think number one, every person is different and everybody takes in the information differently. And some people, it is more difficult than others. And so I think it's being really sensitive to that. And I think that it is overwhelming at the beginning because their body is not cooperating with them. They're having a lot of disruptive joint pain. They have fatigue. Day to day is really different and really uncomfortable. They're not sleeping well. And so it is just things are really off. And I think that my number one advice would be kind to yourself. And number two is just trust and know that when you have the right support, that things will get better. It's a process. It's not instant, but a lot of it is staying in a healthy mindset and really just leaning into and being accepting of okay, right now my body's not cooperating with me. But I'm going to do the best I can and do what my body allows me to do. So I think it's really just that acceptance and just kindness to your body, and then just really surrounding yourself around the people that are only the people that are going to support you and keeping it positive, keeping it healthy. And that is really and keeping moving in whatever capacity you can. I think that especially keeping moving is the ticket to really making progress with arthritis in particular.
Yeah. I'm going to kind of parlay we mentioned about mindset and mental health. So I think we watched it together. There's something on the news right now that anxiety is just at a peak high right now all over the world and our country for a variety of reasons, politics. But my question's about mental health in managing chronic illness. I'm sure there are patients you have that are kind of on that depression, on that anxiety. So does mental health play a role in helping the disease and managing the disease?
Absolutely. I always tell people too that most important is staying in a healthy mindset. And I cannot emphasize that enough. and it doesn't mean you have to be happy all the time and positive. And if you need to be sour and sulking because that's how you feel, that's how you're feeling. It's okay, and it's normal, those feelings, and validating that what you're going through is really hard. And I see a significant amount of people just with chronic pain that have a lot of depression or anxiety. But I truly believe that staying in a healthy mindset and really just, again, being kind to yourself, just doing what your body allows you to do every day, and continuing to be hopeful that that you will continue to improve and progress. I think that is the ticket to your body healing, because if you let your mind go, then your body follows after. So I think it's just, and I had a friend of mine, patient and a friend, who very intelligent, very articulate. And she said that, at the beginning for her, specifically with fatigue, it's like she just wanted to, there's this desire, you just want to sleep. You want to take a longer nap. You could sleep all day. You could lay around all day. But she said you have to just force yourself to just keep your circadian rhythm, keep your routine, move, do something, and then, be proud of yourself for what you accomplished that day, even if it's not like what you were able to do, however many moons before.
Yeah. I'm going to switch gears. Is that cool?
Switch them.
All right. So you defined what rheumatology is really well. So now you are in this new stage of life that I'm so proud of and really impressed. Direct care rheumatology. So what is it? I really do want to know. I don't know what it is. And why did you make this transition from being in academics, being part of like big corporation, to this direct care rheumatoology?
Yeah. So this, I truly, sincerely say it happened organically. I never had the mission of, since I was younger, to have my own practice, but I think it occurred because of the fact that over years and years, the 15-minute appointments, I go back to that. People's care was not at a place at all where it could be. And I was seeing it over and over and over. By the time I get a history, by the time I examine you, by the time I look at your labs, I have 4 minutes to assess you, to think about these complex rheum diseases, what you have, explain my complicated drugs, make sure are your questions answered? Can we talk about lifestyle and your sleep? Like, it's impossible. And so I really was at a place where I said, well, I either leave and do something non-medical, which I didn't want to do because I love rheumatology. And then I said, I know the type of care that I feel I want to deliver, but I need to create the model and the platform. And so that's really where I left my previous position, and I just really started from scratch. And I thought about how can I create this environment for people? So it's really been nice. What is direct care? Direct care is a care model which allows physicians to spend much more time with their patients, to deliver a much higher quality of care, which does improve health outcomes for people that have that value, that are able to have that. And I wish we could. Everybody deserves that level of care. They truly do.
Yeah.
And so I do not contract with insurance, which allows me the freedom to be able to spend longer in appointments and to be able to find the best referrals for you, and to create this network, because I know what my patients need to be at their healthiest. Right. And so it is not the same as concierge, although it is concierge-like, the service that direct care often provides. But typical concierge, because this question comes up a lot, is that they do bill insurance. And so, again, to remove the middleman, so to speak, and to keep things as simple and transparent, and really preserving the traditional old school doctor-patient relationship, where like the doctor comes to your house and they, and people are loving it. I really do think it is just, I see their stress level go down. I see that people that their disease is flaring, you're not going to the ER, you're not going to the urgent care. call me, text me. I'm here to help you.
I want to add on to this because I see it. And, of course, I'm proud of you just because it's me and I love you so much. But you gave up. We were on cruise control and you switched everything up because you believed in better care for your patients. You made this business from scratch. You learned all the things that we never learned in med school. It's amazing, babe. I mean it.
Well, I would say also, I don't have a business background. I don't have an MBA. It was truly like you ask, what is your why? And that's what I was like getting into a mindset of like, can I do this? Should I do this? And my why was that, look, I want to provide this service. I'm really good at what I do, but this system is not working for patients and it's not working for me either. And so it really and I think when you want something that badly and you really see and you can see kind of the light at the end of the tunnel, then you're like, I just have to push a little bit. Let me just kind of learn this. And like I learned, there's like a whole tech platforms and it is, but I have to say it is your support in our partnership that really allowed me to be able to do this, because it's hard. It's a big change, and you're amazing and you're such a great support, because it was like a lot of stuff that are outside of my comfort zone as I was initially thinking about this, and so like I really thank you for just empowering me so that I can really fulfill this part of my career.
Well, but now one thing I've noticed, and I wanted to say this for all your potential new patients out there and my listeners, Dr. Koolaee is so happy. This is the happiest I've ever seen with his new business. You know what I mean? And how do I know that? You know what I mean? I don't know. The 24-hour smile, the positive attitude. You can't wait to crack open charts. You're doing my podcast. Oh my God. So, all right. Everyone, this is a great model. I truly, truly am jealous, and you're going to be under the great care of a great rheumatologist. Let's talk on a podcast and you being on my podcast. Mm-hmm. So I didn't even understand that. You come home one day, you're like, you know what? I want to be on your podcast. I want my own segment on your podcast. Why?
Okay, I'll tell you why. So I really feel that, so I have these amazing conversations with people, and I get to meet some people that truly inspire me, and how gracefully they adjust and they cope with the challenges that they have. And what better way to help other people in sharing stories, right?
Yeah.
Sharing stories that empower others, that uplift others, of how, like, you're in the same position as my 21-year-old, who's we're going to be reporting tomorrow. He has a new diagnosis of RA.
Oh.
Young, any age, it's hard, but like, he's amazing how he's coping with it. I would love to share his story and others like him so that people can feel supported, and you are not alone in the struggles that you have. And it's about connecting people. And I do think, so that was really my why of how can I provide a space where people can share their stories, and that can help others that are navigating through similar. For example, one of the first episodes is a treatment for osteoporosis, which is a daily injectable, Forteo. And your mom doesn't want to go on it. And there's other people. It's a daily injectable. And I feel like I lose them sometimes. And I keep telling them it's not that bad. I promise you'll be great. You're going to be amazing. But I actually interviewed somebody who was in that boat, and who it was the before and after, and she's doing great. And so she's gracious enough to share her story. And so I want other people to hear, so that they can really, it's about feeling your best and making the best decisions for your health. And you need to feel empowered in doing that.
So let me put you on the spot, man. So I've been doing this for like 5 years, and I love podcasting because, I just never shut up. I love talking. Mm-hmm. So you already recorded a couple sessions, right?
I did, yeah.
So what was the hardest part about being the host? Because you never give me some credit for being the host. You're like, Raj just talks all the time. This is what he does. So what's the hardest part
Okay, I think that it's, you and I and many people that are listening, like you're talking to people all the time in your work. And these are normal conversations that you have. But I think it's about you're so excited to share. It's really about keeping it concise. I think that's and staying on track and because this could be a 20-minute podcast or it could be a 2-hour conversation. And although you and I enjoy the banter for a long time, if you're using this 20 minutes to be folding your laundry and having your earbuds, you don't want to listen for 2 hours, or maybe you do. But I think it's, for me, the challenge was keeping it concise and making it where I think about, I want this to be helping people. Is this helping the people that are taking the time to listen? And I think that that really was the biggest challenge, is kind of staying on target.
Yeah. No, speaking of being on target, we're on target, dude. I love it. So I'm going to give you my last question, because I feel I didn't say anything to promote people who want to actually meet you as a doctor or actually learn more about you. You know what I mean? So this is your time to shine. If they want to make an appointment with you, learn more about you, do you have a website, or what platforms are you going to be on?
Yeah. So hopefully my website link you can put in the show notes.
Of course.
But the website is drrmichellekoolaee.com, drrmichellekoolaee.com. So you can check that out, learn a little bit about me. And I do also offer free information calls, which gives me a little bit of a chance to learn about you and understand where you're coming from, and to see if the practice is a good fit for you. And so that I like that opportunity and getting to know people and make sure they're comfortable before making a decision to move forward. Or you could just call. Yeah.
You're pretty cool like that, dude. You pick up the phone, which is the best thing that no one does. Say it. Give your number, dude. You get cut off.
818-531-4274.
That's not our home number, is it?
No.
I'll be very upset. But hey, everyone, that's the Dr. Raj podcast. And I'm just so excited that Dr. Koolaee, Michelle, is having her own podcast. Once again, the first episode right now is going to be the first week of November. And, I just think it's the coolest thing that being your husband, and we do this together.
It's pretty awesome.
I know, it's pretty cool. So I hope you guys enjoyed this podcast, learned a lot. Stay tuned for the next Dr. Raj episode. And of course, listen to Dr. Koolaee's Everyday Rheum.
Thank you. Thanks for having me.
You're welcome.
Thank you for listening to another episode of the Dr. Raj podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep2Go, and you can learn more at medprep2go.com.